This morning on BRN, can the shingles vaccine lead to a delay in dementia? Joining me now to discuss this, Dr. Maxime Taquet is from the National Institute of Health and Care Research and the University of Oxford. Dr. Taquet, so great to see you. Thanks so much for joining us on the program this morning.
It's a pleasure.
Let's talk about the research that you and the team have done. Let's start off with the shingles vaccine. Let's talk a little bit about what the vaccine is, and are there a lot of people taking the vaccine?
Well, so there's been a shingles vaccine for around 10 years, or just over 10 years, and it's recommended for older adults, and it's approved for adults over the age of 50 in the US, and offered for free in the UK to adults over the age of 65. And it's an important and good vaccine to prevent shingles, which is a reactivation of the virus that causes chickenpox, mostly in childhood.
Yeah, and I for one have had chickenpox. I think I was 12 or 13. It wasn't a pleasant experience. My understanding is shingles is a lot worse than chickenpox. Am I wrong about that?
Well, shingles tends to cause pain in one part of the body, and can be a different part of the body, different depending on people. No, pain is very uncomfortable, and something that if we can avoid it it would be important, valuable in of itself. But sometimes it affects other nerves in the body that might cause loss of vision, loss of hearing, and those are even more concerning consequences of shingles. And that's why having the shingles vaccine as part of the tool in medicine is very important.
And you and the team have discovered through research, discovered another positive effect of the shingles vaccine, and that is it could delay dementia. You can tell us a little bit about that, doctor?
That's right. So there had been a hypothesis that the shingles vaccine can decrease the risk of dementia, but we provided first evidence from sort of causal evidence that it might well be related to a decreased risk of dementia. And this is important, and if confirmed, highly relevant for public health.
Yeah, and so you can kind of, in some ways, kill two birds with one stone. Probably a bad analogy, but really, simply, you can take the vaccine for preventing shingles, but in a way delay the cognitive decline that many people see in their later years. Is there any understanding as to why this would occur, doctor? Why this would help reduce the cognitive loss of dementia?
Well, our study cannot answer to the question of mechanism, but there's been other studies because there's been great interest in the link between shingles and dementia. And some other research has highlighted the possibility that the virus, so the virus causing chickenpox and shingles, might cause dementia directly through invading the brain, or through causing problems to the blood vessels, and those might then cause problems in the brain themselves. But it might also be that the vaccine, which contains an adjuvant, another molecule, if you will, and that molecule stimulates the immune system, and that's its role in the vaccine, is to stimulate the immune system to make the vaccine work better. It might well be that immunostimulation, so the stimulation of the immune system, might itself reduce the risk of dementia.
And doctor, is it important for anyone age 65 and older? So should I be considering the shingles vaccine and vis-a-vis this important finding in lowering the risk of dementia if I'm younger than 65? Say dementia runs in my family. I have loved ones, mother, father, sister, grandfather, grandmother that have had the disease, dementia. Should I consult my practitioner to see if it makes sense to actually have the vaccine sooner to prevent future cognitive decline?
Well, so the vaccine is approved for people from the age of 50 and over. It is in the UK reimbursed, and in Australia reimbursed for older people, but it's already approved for people over the age of 50. Now, I think the value of the vaccine in preventing shingles is good enough itself to recommend using the vaccine. But certainly, if it can also lower the risk of dementia, and if that can be another reason for people to be willing to get vaccinated, then that's, as you said, potentially killing two birds with one stone. But we should be careful that the data and findings that we have are observational studies still. So they are providing some causal hint, but they need to be replicated in a large-scale clinical trial to make sure that the link is indeed causal. Whereas it's the effect of the vaccine against shingles is itself very, very well established through randomized controlled trials.
So is the next step in your study, in your research, to get that clinical trial to test for, I'm a layperson, so I'm not a doctor, but I would think that would probably be a next step in the research.
That's right. So as a research community, I think the two next steps are to understand the link, the mechanism, because that might prove very fruitful as a way of understanding the what's causing dementia, and also running potentially a clinical trial, so a study where we compare people who receive the vaccine to people who do not receive the vaccine in a randomized way, much like we do for any kind of treatment. And this is the gold standard in medicine to know that a drug is effective at preventing or treating a particular disease. And so this would be the next step as a community. I'm not saying that I would be the one running that, but this would need to be done.
Right. And I guess, can you make the link that if you can figure out how to delay dementia, ultimately somewhere down the line, maybe you can find out how to completely prevent or reverse dementia. I mean, that is a possibility further down the line with more research, Doctor.
Well, that would be fantastic, obviously, but there's many steps to go through before we can show that. But obviously, if this can happen in the next decade, then this would be a fantastic news for people, for healthcare services, and for public health in general.
Yeah, and having families get their loved ones back. You lose your loved one, whether it's dementia or Alzheimer's. Dr. Taquet, we're going to have to leave it there. Thank you so much for doing it. Thanks for doing the research, and we look forward to having you back on the program again very soon, sir.
Well, thank you very much for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, and get all the news in one place. Details at our website. We're back again tomorrow with another edition of BRN. I'm Jeffrey Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.